Hello everyone. So this video is specifically for those who are currently in a lot of pain. If you are watching this, I think you already know why the results came out, and if you are one of the candidates who saw "thank you for attempting the exam" word as a first letter of result email on your screen, then this video is for you. Only for you. I know what happened for the last 24-48 hours. You didn't sleep. You went through every question in your head. You messaged one or two close friends and pretending you were okay. You may or may not even tell to your family. Some of you are on your third or fourth attempt right now, and you are wondering if you should even try again. Please hear me. I have been sitting with this kind of WhatsApp messages since yesterday morning. You are not alone, and this is not over. Now, I want to be useful to you, not just motivating. Because in the next few weeks, you are going to make a decision, and how you will make it will change the next year of your life. So, let me give you two things: a clear diagnostic framework to understand what actually happened, and a specific strategy for what to do next. No motivation, no hope, just clear analysis. As a clinician, whenever you see any patient, the first thing is to do a diagnostic evaluation, which includes the clinical or the investigations, and then you go on to management. So why not we can apply the same framework to our exam preparation as well. So this video is not a motivation video, and it is going to talk about the clear-cut diagnostic strategy and how to manage the condition. Yes, of course, you may come back to have your personal communications. Almost every failed candidate sends me the same first message. Ma'am, I did not study enough. I need to study more. Maybe I was not prepared. This time I will read every guideline properly, cover to cover. I'll cover every point. Please stop. This is lie. Did not fail because you studied too little. Look at how many hours you have put in. Look at the sacrifices you have made. Look at your family, your night duties, your OPD hours. You gave everything you had. If more studying was the answer, you would have passed. Studying more is what you already did, and it did not work. So before you go back to the same books, same guidelines, please stop for a moment and hear the actual answer. Before I tell you what to do next, I want you to look at your result honestly. Because how you failed matters more than the fact you failed. Look at your percentage. Look at how far you were from the pass mark. Because this is the report. We look at investigations every day, but this is your report, and this does not just show you that there is a way forward, rather, it gives you the right direction where to go. It's only that you need to know how to analyze this report. And here I'm going to give you 2 points with which you can see in what direction you have to move. If you missed by 1 or 2%, your strategy was largely working and you were almost there. What you need is a small fine tuning, a sharper focus on the specific patterns of questions that tripped you up. Maybe another 20-30 targeted questions more per topic can help. So more of question practice, slightly deeper looking into the traps in few high yield areas. You are not starting from scratch and you don't need to. You just need to refine it a bit. As you just clarify the high yield areas, that's going to be perfectly fine. But if you missed by 3, 4, 5% or more, the gap is not a tuning problem. That's a strategy problem. It means the way you have been preparing has real gaps, either in the content or your understanding of the question or how you are thinking about the exam. And repeating the same approach with more effort will not close that gap. This is genuinely useful about yourself, useful information. This is your report, and this can help you make a correct diagnosis. Do not skip past it. Sit with your report, analyze it, and ask honestly how much you are away. Because the answer changes what you do next. Whichever side of that line you are on, the direction of the shift is the same. Go deeper, not wider. MRCOG does not test whether you have read every guideline, it tests whether you can think the way the examiner wants you to think. The candidates who pass are not the ones who have the widest knowledge or who have done the widest reading. They are the ones who understood the pattern and the pattern of how the same 40, 50 topics are tested again and again with different clinical stems. Going wider, more guidelines, more question banks, reading everything cover to cover will not help you. It will just exhaust you. Going deeper, understanding the examiner's mindset on the topics that repeat, that is what changes everything. So, actually, what you need is a concise content which you can revise multiple times, because as you revise multiple times, you go deeper into it. But instead of that, if you choose to go by the overwhelmed syllabus, repetitions are not possible, and there you lose the depth and the focus. It comes to me after failing twice with other some courses, big names, full courses. She has done everything anyone told her to do, and she still missed by 4 or 5%. That gap told me straight away. She wasn't nearly there and just needing more effort. So she had a strategy problem. The approach itself needed to change. One student in particular, I remember her clearly because she came to me just 20 days before the January exam. 20 days. I told her, don't make more notes, don't try to cover more chapters. In these 20 days, we are only going to change how you think. Her scoring went up to 3 to 4% in those 20 days. She still didn't pass that attempt, but she missed by 1%. But she felt confident because now she knew what is the right direction. So, in the next attempt, she again started reading with us. And here's in this fourth attempt, she could just smash it with a good percentage because her problem was perfectly diagnosed and she got the strategic thinking of how the RCOG examiner sets it. So, therefore, it is important that you understand exactly what part of guideline is important and focus on it, go through it in depth, and figure out the examiner's mindset. So, what changed in her preparation? Her structural problem became a tuning problem. And once she was in a tuning range, she found her way fine. So, what do you actually do in your next 30 days? Let me be concrete. Stop making notes. First thing, it's just waste of time. It's passive learning, not productive. It feels productive, but it is not. They are not. Every hour spent making notes is an hour you did not spend thinking like an examiner and piling up the papers. Stop passive reading. Do active learning. Right? You go through the chapter, you go through the guideline, or maybe like a good concise video content. Like we provide you with a 10 minutes bite-sized videos. 10 minutes, you have a full attention over it. You learn the concept like this. And then when you are solving the questions, now write what you remember from your brain. This is what is known as active learning technique. This actually comes from the brainstorming. You are doing a brainstorming, so you are writing what exactly you remember, because finally you are not going to take those papers to exam, your brain is going with you. So the material should be stored in your brain where the learning happens, and this is what we help you with. But this shift, active learning over passive study, you can start today on your own with any question bank which you have access to. So you can start any moment, but shift yourself from passive to active learning and see the difference. So till now we have talked about the diagnosis, how to diagnose where you are standing, what kind of a strategy you need to follow, and how to shift from passive to active learning. So that's what makes the difference. So before you go and decide anything, take a rest. Do not decide today. Do not decide this week. This week you rest. You cry if you need to. You sit with your family. You do not open a book. You do not open a question bank. Do not send another message. What should I do? Then, in a week or two, when the pain has settled a little, ask yourself one honest question. Not, do I have to it in me to try again? That question is too big. Ask this instead. Am I willing to try a different way? Yes. The answer is yes. You have a passion. You have a next chapter in front of you. You haven't failed. You are not starting from the scratch. You know what does not work for you. And this is the starting point, not the ending point. So if you want to talk about what to do differently, I'm always there to help you out. But definitely take a time, take a moment, analyze your report and figure out the right steps. Anytime you need my help, I'm going to drop my WhatsApp number and a QR code from which you can scan to book your call with me and a currently. But this is what I want to say now is, please talk to someone who can help you diagnose why the gap is that wide. So I might be the person, or you may talk to some mentor, but the diagnosis matters more than the effort. You are not your result. You are a doctor doing something extraordinarily difficult, and you have not stopped. That is what matters. Sending you all so much love and hugs. See you soon.